This is the award-winning Lee Pitts Live.
Brought to you by the North Law Firm. For car accidents and negligent security cases, call Joe at 239-337-1191. And by Lee Health.
Southwest Florida, welcome to another edition of Lee Pitts Live. I am so excited about this particular show. We're coming to you in the Naples area, Interim HealthCare, and we're going to talk about Interim HealthCare in Naples, Lee, and Charlotte County. What a great organization that is keeping people healthy and taken care of outside of the hospital. We're so thrilled to have guests here from that organization in the first part of our show. In the second part of our show, we'll go out and talk to a local politician who's running for the Lee County School Board. All this happening on Lee Pitts Live. We'll be right back. Welcome back, Southwest Florida. We're so thrilled to have two outstanding individuals who are leaders here locally, Kim and Charles with Interim HealthCare. Both of you, welcome to the show.
Thank you.
Charles, I'm just going to call you Chuck, right?
Chuck is fine, yeah, absolutely.
Okay, very good. First of all, I want to compliment you guys on the outfits that you're wearing. They're very professional. They look really, really nice and represent Interim HealthCare very well. Chuck, what is Interim HealthCare?
Interim HealthCare is a senior healthcare company. What we do is we keep people in their homes as safe and as long as we possibly can. Interim HealthCare's been around for about 50 years, but the beginning of the company really goes back to 1946.
Really?
And it's been built on care, integrity, taking care of people, and that's kind of been the theme of the company all the way through. And it's always been in caring for people and taking care of people.
But when you look now at how you guys have grown to be national and international, and you being a part of that whole nice corporation, how does it make you feel personally to have your company be a part of that here in Southwest Florida?
Well, being a national company has a lot of benefits, mostly that we have the resources to take care of our clients better. And I think that's really important because we have a very big company that's producing all the operational support that we need. And so we can rely on them for that. And all we have to do is worry about taking care of our clients and making sure they're getting good care.
Why did you decide to become an Interim HealthCare franchise?
Well, I think anybody gets into this business, they're in it because they care. And Kim's personal story is on her website. My personal story is on our website. But I think we both took care of family members. We both all have been caregivers all our lives. And we just wanted to help other people understand how to take care of themselves as well as the family members they're taking care of. Both of those people are incredibly important because the caregiver needs as much help as the person who's receiving care.
I see. You're in Lee and Charlotte County.
That's correct.
Do you find that caring for people in different parts of the area have different needs, or is pretty much very similar throughout the region?
It's very similar. And you're dealing with one of two types of people. You're either dealing with a client or you're dealing with a caregiver of a client. And their needs are very similar and the problems are very similar.
Mm-hmm. Kim, when we're saying clients, describe is there a such thing as a typical client for Interim HealthCare, and how would people know if this would be the perfect place for them?
Well, that's a good question, Lee, because we find that 90% of people want to age in place. So with that, our caregivers, CNAs, and nurses help them by doing that, by doing different daily activities with them that they can no longer do for themselves, like maybe bathing, simple tasks like doing their own dishes or grocery shopping. Our caregivers, CNAs, and nurses go with them wherever they go. Maybe they're in the hospital. They can start out with them there and transition back to them at the home. So they know everything about them from that point of start of place where they are. We can do a free evaluation anywhere that they are. We'll go in and do that. If they call us and say, hey, we're in the hospital for maybe a short stay for a surgery, and transition them right back in their home, whether it's CNA care to help with bathing and finish out their care there, or maybe stay with them until.
Now, to tap into your services, people can just call that number on the screen for Collier County and call that number on the screen for Lee and Charlotte counties, when they call your office, tell us how a typical call may go.
But when they call our office, they usually get it off of either, like you said, off the screen right now today, or they either Google us, or they can get it off of different places like caring.com, or maybe Caring Homes, a lot of the places where they look for places when they need that times of care. So when they call the office, what we do is a referral intake and find out what kind of care it is they particularly need.
Gotcha.
So further evaluation takes place in the home, which is free, and that's when we find out exactly what kind of care they need, whether it is a CNA or maybe it is a nurse. So we do different types of care, all the way from skilled nursing to just the CNAs, or maybe just a companion.
And the fact that you have a nursing background that you bring to your Naples operation, having a nursing background, does that give you an additional type of feel for what's going on out there?
Oh, it does, Lee. Thank you for asking that. And it also gives our clients and patients a lot more oversight with our companion CNAs and other nurses that are under our scope of service. So I also, before I became, like Chuck was saying with our personal story, before I became involved with Interim, I worked for them 4 years previous to becoming part of the network. So yes, absolutely.
Senior age, is there some specific things you would do to help seniors age in place?
Yes, like helping them bathe in their own home. So a lot of seniors, 90% of them, want to stay in their own home.
Like my mom is doing right now, and she's getting care in home back in Alabama, so you guys couldn't be. I'm sure there's an interim in Alabama, but my sister happens to do the same thing that you guys do.
Oh, that's fantastic.
Right.
And so sometimes the children may live in another state, and so they want to find a company that is has the experience and the people in the background that know what they're doing. So they call people like Chuck and myself and other Interim franchises that are independently owned and operated to make sure that they're getting the care that they need in the home, because they don't want to particularly go to a facility. They want to stay in the home where they've been their whole lives.
Right.
And the children want to make sure that that's what they're getting is what they want. So that's what we do at Interim.
Going over to you, Chuck, does the person who's assigned to that particular client, do they spend the night there sometimes, or is there certain hours of the day that they're with the client?
Well, we take care of clients from a couple hours, 1 day a week, to 24 hours, 7 days a week, 365 a year. So I think it's critical, as Kim said, to get that assessment in the beginning, really determine the level of care that that individual needs, and then match that care to the time that you're in the home, and make sure you're delivering on the needs that they have.
And they can do a wide range of things. I'll stay with you, Chuck. They can do a wide range of things, from taking blood pressure to making sure they take their medicine at the right time, getting them to their doctor's appointments, all those types of things.
Transportation, socialization, going to church, picking up dry cleaning. There's literally not much we can't do to help them stay in their homes.
Real world situation, somebody's a disability, can't walk, something of that nature. You guys got that handled as well?
We do. And also, if they do have the disability and they don't have the resources to maybe get a handicap ramp or the handicap accessories in their homes that they need, we can get those resources in the community that they're in, whether they're in Lee County, Naples, Collier County.
Now, if I'm sitting back and I'm saying, that sounds pretty fancy, this type of service that you're providing, I have to be rich to have it. Am I wrong? Do you have to be rich? Go.
You don't have to be rich. There's many types of insurances that can pay for it. Maybe a long time ago, you signed up for a long-term care insurance policy that you forgot about. So we can get the resources that can find out different things like that. Maybe you're a veteran that you don't realize that there's a plan that can pay for it that way as well. And if there's a different plan out there, we can get the resources that can find out for those types of services as well. Some people do pay out of pocket, but many people do have different resources available to pay for these services.
I want to go one more step on that. I'm thinking that at some point somebody may have filled out some insurance information and they checked the box for long-term care or what have we, and they don't. When you say they may not have realized that they checked that box and that's a part of their insurance policy, is that what we're saying, Chuck?
Definitely. Some people bought long-term care insurance decades ago.
Okay.
So understanding the coverage and understanding what's included in that policy is something that we can help work with the insurance company to figure.
Is it pretty standard sometimes? Pretty standard is in those policies?
No,
Okay.
long-term care policies are all over the place, and so that's why it's important to find out what they've got, help them talk with their agent to see what's covered, and make sure that they're getting the care that they need.
When I was, this is so interesting to know about, and one of the things I was thinking about is you were naming some of the different benefits of how your care providers do things. They have various qualifications, right? So it could be, but they all experts at what they do. So who are the people caring for these people? What's their backgrounds?
Well, what's good about our company is our employees are bonded, insured, they're drug screened and background checked. So being that they're our employees, they're not independent contractors. So what you get for a benefit with that is you're not liable for those employees. That makes them insured by us. And the other thing is, with what you're talking about with them being, with the other question you asked, if somebody had a chronic illness, but the other thing that we do at Interim is we have over 300 CEUs that they can get on our online university, and they can train, and then we can skill match them with a particular patient. Say maybe they have a chronic illness like diabetes, and we can make sure we train them into taking care of that particular patient.
Okay, so how do you get people who work for you? This is an opportunity now. People who are watching right now, so that might be a company you want to work for as well.
We have people that actually just walk into our office. We have ads on Facebook. We have ads on Careers by Web. And sometimes we get referrals from some of our best employees. And that only brings the best other employees to us. That is the way we find a lot of them. Or they can go on right to our website.
Good. You work with people with chronic diseases as well, like diabetes and chronic diseases in general?
Yes, we do. We have a great program for that. And like I mentioned before, the CEUs that the caregivers can get, the university is free to them once they're on with us, and the patients and our employees can benefit from that.
How about back to you, Chuck, how about the attention to detail, making sure that everything is being provided to the clients as expected? Do you have a way where you go out and check the checkers?
Sure we do, and this is an area where I think Interim HealthCare does something that not a lot of people do, and that is we voluntarily take a higher level of accreditation than is required by the state. It's called the CHAP accreditation. So every Interim HealthCare franchise is accredited by CHAP. So the standards are way more than they would be if the state were giving us the standards. And so we know that's a higher level of care. We call our clients every month to see how things are going. We do supervisory visits every 5 to 6 weeks to see if the client-caregiver match is working out. And we have a scheduling system that tells us when people got there, when they left, did they do what they were supposed to do while they were there. So when it comes to client care and monitoring client care, I think Interim is the best. I'll be very honest with you.
What is the phone number, verbally, what is the phone number for Lee and Charlotte County?
Well, they can reach us through our main office in Charlotte, which is 941-787-5636.
Certain times of the day or 24/7?
24/7.
I like that. How about in Collier County?
Same with Collier County, 24/7, and it's 239-302-3278.
When we say 24/7, that means that you guys are working, like you were saying, you're working with people 24 hours a day.
Absolutely.
So that's very interesting as
And
well.
our on-call services in both counties, or all 3 counties, is 24/7. So if a client's got a problem at 1 o'clock in the morning, we're there and we're answering that phone.
Okay, this is Interim HealthCare. You've been seeing their commercial on television. Let's take a look at a commercial right now.
You know us. We're the nurses and therapists in your hospitals. We're the caregivers in your homes in over 300 communities across America. We're Interim HealthCare. We've been finding better ways and working hard to make living healthier and happier for you and the people you love. Interim HealthCare. Across the street, across the country.
Kim, that's a nice commercial across the street. Why do you think that commercial is so effective, and what do you see when you see that commercial?
That speaks to me on a personal level because it just shows, like I was talking to you about before, how if you have your parents are in another state, like one of mine is right now, and you can't get there because of maybe work and other things, you know that Interim is there, and you know you can count on them to be there for you in the times that you can't be, to do the things that they can't do anymore, like grocery shopping, and you can depend on us to be there to do those things.
Final comment, Chuck. Of course, we'll be talking to you guys throughout the year, but if you want to make sure you left the viewing audience with something that they need to know about Interim HealthCare, what would that be?
We care. You're not in this business unless you care. You don't get into it unless you care, and you don't stay in it unless you care. And I got to tell you, the way we hire people and the people that we surround ourselves with every day are people who really care about the people that we take care of.
Outstanding. Couldn't have said it better myself. Looking forward to getting you back on the show in the future, okay?
Thank you, Lee.
Thanks.
As the saying goes on this particular show, for those who say it can't be done, they are usually interrupted by those like Kim and Chuck and all the fine people who are associated with Interim HealthCare, especially here in Southwest Florida, who are doing it. We'll see you.